Colorado's hospitals are nearing a breaking point. The state is seeing peak hospitalization numbers as Colorado struggles to contain the coronavirus. It's forcing the state health department to implement what's called crisis standards of care to help hospitals with staffing. Thanks so much for joining us here for Denver 7 News at 11. I'm Jason Grenauer. The map from the CDC, this one, shows exactly what Colorado is dealing with. The entire state shaded in red, which means there's high COVID-19 transmission. The state estimates 1 in 48 Coloradans is infected. Let's take a closer look at the numbers. More than 1,400 Coloradans are in the hospital with the virus. It's the highest number since last December. Nearly 80% of those patients are unvaccinated. The state data shows 93% of ICU beds are currently occupied. That means only about 100 beds in total are available. So what does all of this COVID hospitalization data mean for Colorado's hospitals? Well, the state health department is now at level 3 status, so it activated a crisis standards of care. As Denver 7's Eric Lufer reports, this gives hospitals a break from the normal staffing requirements.
This is a directive to prioritize worker and patient safety. Those two go hand in hand. So what does this exactly mean? Well, it changes the way hospitals prescribe drugs, the ordering of tests, the performance of any evaluation, treatment, surgery, or procedure. Big changes. All the while, we're hearing from doctors and nurses on the other side of the walls.
I wish that people could see what I see.
This is Dr. Diana Breyer, a UCHealth critical care physician, in a video diary provided to ABC News by UCHealth, giving us yet another glimpse of what is happening on the front lines inside area hospitals.
I don't want to see you in these ICUs afraid because you can't breathe and getting on a ventilator and potentially dying.
The urgency, something Colorado's chief medical officer Eric France wants frontline workers to know he recognizes.
This first step of activating the staffing crisis standards of care is to help out hospitals and to acknowledge the healthcare workers that they're working in trying times.
At first, health leaders predicted hospitals would peak by early December. Instead, it happened about a month early, with crisis standards in place until further notice.
We will keep it active until we get through this press on our hospitals.
In another video diary provided by UCHealth to ABC News, registered nurse Casey Pete tries to stay upbeat as she treats people with the monoclonal antibody.
My shift is done. We saw 23 patients today. We did have to send one patient to the emergency room as their oxygen saturations weren't high enough for treatment today, and she didn't look good. You can see my nose. My nose is dented. I have dents in my cheeks. My hair is a mess from all of the straps. But it was a really good day.
The continued message from health leaders: getting vaccinated and getting the booster if you're eligible.
My hope is that we can continue to work on folks who are unvaccinated to get vaccinated and prevent excess hospitalizations.
I'm Eric Lufer, Denver 7.